There's a word for people who fight tirelessly against a formidable enemy that has robbed us of wonderful individuals living to their full potential for too many decades. There's a name for someone who's facing the future with their eyes wide open, aware of the risks that lie ahead. And there's a word that means nothing, yet it means everything to people living with HIV. And a name for people who face prejudice and are treated harshly for simply living their truth. There's a word that applauds every step forward in the fight against HIV. There's a name for people willing to fight at the forefront for a cause. And now there's a name for the tens of thousands of patients, employees, and supporters who represent the new face of HIV. Vivent Health, providing comprehensive prevention, care, and treatment for anyone and everyone affected by HIV.
Hi everyone, Michael Sam here. I'm really honored to have been invited to join you today for this important discussion about how we can move towards making HIV history and fight stigma against the LGBTQ people. I wish I could have joined this panel of distinguished speakers, each of whom are doing so much in the effort in the great Somi state that I've called home for many years. I hope that by me sharing a little of my own experiences and sending this message of support, I can help in a small way to continue the important mission of advancing rights, protections, and equality for all LGBTQ people. America prides itself on the God-given rights and freedoms of its citizens, and yet for too long now, we have classes of citizens whose rights have been taken away from them. The impact this inequality has had on the LGBTQ community is astounding. LGBTQ people across the country face persuasive discrimination and stigma which severely impacts their health, well-being, and ability to live and work a normal life, including higher risks of mental health, substance abuse and addiction, higher rates of suicide, especially amongst the LGBTQ youth, denial of federal benefits, sexual assaults and violence, employment and housing discrimination, just to name a few. I have experienced this discrimination firsthand. I've had renowned coaches say they would not draft me, not because I wasn't good enough of a player, but because they didn't want to deal with the fact that I was openly gay. That's not to say people weren't supportive of me. My biggest supporters were my Mizzou family. And with the support of these people, I was able to triumph above the discrimination and adversity and negativity to achieve my dream of owning my truth. The inequality and discrimination LGBTQ individuals face stems in large part from cultural A norms, laws, and policies that don't treat us LGBTQ people as equal Americans. For example, Americans in 27 states, Missouri being one of them, still aren't protected against employment or housing discrimination simply based on their sexual orientation or gender identity. Fortunately, there are some pioneers out there who are leading the charge to address this imbalance, and you'll be hearing from some of them this afternoon, including Missouri policymakers who have introduced the Missouri Non-Discrimination Act and the CEO of Vivent Health, which is leading the healthcare provider for LGBTQ individuals. The Constitution of the United States, in which the fundamental rights for all U.S. citizens are enshrined, begins with three powerful words: we the people. I worry that without the passage of policies like MONA and breaking down stigma against LGBTQ people, the beginning of our Constitution can be only read, we some of the people. Thanks again for inviting me, and enjoy the event.
First, I want to give a big thank you to Michael Sam for your message and your commitment to ending stigma. Your journey from an All-American at Mizzou to becoming the first openly LGBT player in the NFL is inspiring to many, many people, and it has been made even more so given your very public dedication to advancing equality and understanding. Today is a very historic day, aside from what the Pope announced earlier today. But we're building on this year's national conversation hosted by Vivent Health and bringing together thought leaders, advocates, people affected by HIV, and elected officials, all to engage in a new conversation on what it will take to end HIV right here in Missouri. And we want all of you who are watching with us to participate in this conversation. We are going to be reading some of the comments in the chat box, and we will do our best to include your questions here today in the conversation, and we promise we are going to get to as many of them as we can. But first, I want to introduce our great panel because we have a lot of really special guests who are giving their time today. First, I want to introduce Mike Gifford. He is the president and CEO of Vivent Health, where he has been a leading force in the fight against AIDS all across this country for more than 27 years now. It was under his leadership that Vivent Health has now become one of the nation's leading HIV prevention, care, and treatment providers, now serving more than 10,000 people annually with locations in Colorado, here in Missouri, also Texas and Wisconsin. Mike, thank you for being here.
Thank you for
today, Representatives Mike Stevens. He's a Republican and a graduate of Southwest Baptist University and the University of Missouri Kansas City School of Pharmacy. He opened Stevens Pharmacy in Bolivar, Missouri in 1975. And being in business for 40 years and working with families from all sorts of different backgrounds really gives him a valuable and unique perspective to identify the needs and make decisions to improve those patients' outcomes and their situations, not to complicate them even further. Representative Stevens is an ardent supporter of Mona and has been in many sessions. We want to thank Representative Stevens for being here today.
Thank you.
Thank you. We also have Representative Greg Razor. He is a Democrat and he represents portions of Jackson County, specifically District 25, what I like to call the west coast of Missouri, and that Missouri House of Representatives. He was elected to his first two-year term in November of 2016, re-elected to a second two-year term in November of 2018, and now Representative Razor is the Democratic candidate for Senate District number 7, here in about 13 days, right, Representative? 13 more days?
13 days to go.
So he was born in Blytheville, Arkansas, and has now made his home in Kansas City ever since December of 2001. Also a very ardent supporter of Mona across many sessions of the legislature. So Representative, thank you for being here.
Thank you.
So our first question of this conversation here today is going to go to Mike Gifford. So since the virus first came to light back in 1981, there have been quite a few significant changes in terms of HIV prevention, HIV care, and treatment, as well as who is impacted by the virus. Could you please give us a snapshot of what the current state of HIV in Missouri is, and what are the most important recent developments?
Jacob, it's a great question to start off on. Thank you for hosting us today. Representative Stevens, Representative Razor, thank you for being here today, but much more so for all of your strong advocacy in the state legislature on Mona and other critical issues for the LGBT community and in the fight against HIV. You know, Jacob, you asked about what is the state of HIV in Missouri right now. And sadly, there's a record number of people living with HIV. There's a record number of people who need access to life-saving prevention programs like PrEP, one pill once a day, biomedical intervention that is almost foolproof in protecting somebody from contracting HIV. And sadly, the COVID pandemic makes those very difficult realities even worse for people living with at risk for HIV, either from a health perspective or from an economic perspective. So it's a really challenging time in the fight against HIV, and it's a time for all of us to redouble our efforts. And I am so proud of the people of Missouri. It was great to hear Michael Sam talk about we the people. The people of Missouri spoke so strongly in adopting a Medicaid expansion here recently, and that is a critically important step to better fight HIV here in Missouri. The partnerships that you're going to hear about today with Vivent and with Promo and with Pride in St. Louis and other organizations like Washington University and Doorways and Thrive Health Connection, in Kansas City. All those partnerships are really good news in the fight against HIV right now. And we're really excited that our HIV medical home is now fully operational in Missouri. This is the only HIV medical home that's been approved by the federal government. It's nationally recognized for creating some of the best clinical outcomes, allowing people with HIV to live longer than ever before. And we're really pleased that we're able to provide that integrated health, medical, dental, mental health services, along with all sorts of services to help people overcome social determinants of health. But there are great challenges beyond the record number of people living with HIV, beyond the number of people who need access to care. And one of the tremendous ones, sadly, continues to be stigma and discrimination. So we made so much progress in the fight against AIDS since the early 1980s, but we've made precious little progress in the fight against stigma and discrimination. That just makes it harder to access health care, harder to access the prevention education that people need to live a long and healthy life. So events like this that allow people to learn about and become advocates for dismantling stigma and discrimination and racism is so very, very important.
Mike, thank you. So if I'm hearing that correctly, we have a duty to break down the barriers, create access to care, address stigma and discrimination, goals that I think we all share in terms of eradicating HIV here in Missouri. And I want to bring the conversation now to our elected officials who are giving their time today. So Representatives Stevens and Razor, this is for you. There are currently 23 different states here in the US of A. And Columbia that have state laws.
A moment, my dog's making too much noise. It's a moment.
That's okay. We live in a virtual world these days. It happens to all of us. There we go. Okay. So
try that. No, go ahead. Do that again, please.
Right now in our country, there are 23 states, including the District of Columbia, that have state laws protecting people from employment, public accommodations, and housing discrimination based on their gender identity or their sexual orientation. 27 states, Missouri included, however, do not have such protections in place.
Yes.
Now, at the ripe old age of 21 years old, the Missouri Non-Discrimination Act, which we all call MONA, tries to address this. So first question, is there political will in the state of Missouri to finally pass MONA? And the second part of the question is, what more can be done to get it across the finish line? And I guess there's a third part. What stands in the way of getting us across that finish line? So,
you want to start, Greg?
I'll jump in on that. So the questions are, is there political will? What stands in the way? What more can be done? My answer to all three of those questions is not to be partisan, but they're the ones in charge: Republican leadership, Republican leadership, Republican leadership. We have fantastic Republican members like Representative Stevens who stand with us. I think that MONA is something we could get past, but leadership in both the House and the Senate in Jefferson City refused to bring it up, refused to allow it a vote. I think if we brought it to a vote, it would pass. We have more and more folks like Representative Stevens who are straight, who are rural, white men who are coming out saying, this is wrong, it's time to end this. We're now seeing organizations like the Missouri Realtors Association coming out in support of MONA, primarily from an economic development standpoint. So there's a lot of momentum, there's a lot of stuff going behind the scenes. We need to activate the people in the districts that the leadership of the Missouri General Assembly live, to put pressure on them to move this. And until we do that, we're going to continue to struggle.
I think that the leadership, the change in leadership that's taking place right now, I believe is going to be more hospitable than it was in the past, at least in the House. And I'm not sure. I'm a little surprised that isn't it Senator Rowden? Isn't he the floor leader in the Senate?
Yes.
From Columbia. I presume that he's up for re-election. I think it's a tightly contested race, so I'm not sure. I'm assuming he'll be returned, but for that district, it seems to me that Senator Rowden's district is very hospitable for this type of thing. I'm just kind of reading minds here. I don't know who's going to be our floor leader. I believe that I know who I think probably has the edge on it, and I believe that there's going to be a more hospitable and receptive attitude in the leadership. That said, I have talked with Greg. Greg and I've had lots of conversations over this over the past few years, trying to get this moving. We've have made our feelings known on the floor on some occasions. To me, if this is going to get legs, and I think it can, it is going to have to be based. It's going to have to be based on an economic plea, or it. What is going to make the difference in our caucus is it going to be not on a social issue, not that only that there are aspects of it that some people are still a little uncomfortable with, but what I keep hoping for and looking for and asking for and pleading for are for the economic interest to make a bold step forward. I mean, I think that the Missouri Chamber of Commerce has opposed this in the past, and I think that it's not that they have a vendetta against gay people so much as that anything that smacks of a possible lawsuit, they run and hide from. But they have at least retreated, at the Missouri Chamber of Commerce has at least retreated from an opposition to a neutral stance. That has happened in the past couple of years. But the chambers of commerce in St. Louis and Kansas City both need to step forward in a very, very emphatic way. And along with that, industrial leaders are going to have to step forward in a major, bold, unequivocal way. They need to come with concrete. I mean, I can go to our members and say, the lack of this protection is standing in the way of economic development. I mean, I can say that over and over and over again. But these companies are going to have to clearly demonstrate that the talent that they require in order to advance their companies and to grow, that talent that there have been specific instances that I know that Greg is certainly aware of, where people who would come to Missouri and to help us grow our company, people of extraordinary talent, but who find this lack of protection an obstacle and a discomfort. Just not that they've heard that people lost their job because they were gay, but it's the vulnerability is out there, and it just is an obstacle. That message, that obstacle to economic development is going to have to be the central theme in order for Mona to advance like this. And I do believe that it can. I do believe that it will. I do believe that the leadership that is shifting now is going to be more hospitable. If Senator Rowden is returned, I think that with his district around Columbia, it would be an issue that he could very, very comfortably embrace for a variety of reasons. But I urge the people who are trying to move this forward to really focus on this as an economic development issue, and to get people clearly and forcefully on and coming forward and speaking with a loud, clear voice that this is standing in the way of economic opportunity. I mean, it's wrong. It's a vestige of another time that just has not been corrected. I swear that you'll hardly find a person on our side that thinks if you're gay you ought to get fired. I do not believe it. But the vulnerability is there, and people are aware of it, and we've got to get rid of it.
Well, I'm encouraged to hear that that there's a chance. We've been through 21 sessions and it hasn't happened yet, so I'm encouraged at least here that there's an opportunity in the next session that it could advance. Mike, I want to bring you back into the conversation. You've seen a lot in your work all across the country, also leading organizations that's on the ground to provide services and access to HIV healthcare. As you know, the HRC, the Human Rights Campaign 2019 State Equality Index assesses how well individual states are doing to address LGBTQIA individuals from discrimination, and they gave Missouri the lowest possible ranking. I just have to take an aside here and plug the actual city of St. Louis, where I'm at. We have a A+ 100% score going for 10 years straight now, but we're talking about the state of Missouri, lowest possible ranking. So I want to know from you, Mike, in addition to passing MONA, what other measures do you think Vivent Health, other thought leaders, other organizations can do to right this wrong? And how can nonprofits and allies kind of come together to overcome the stigma outside of legislative action?
All right, it's a great question, and I share your assessment of what we heard from the two representatives. The optimism that there's a pathway forward for MONA is really exciting, and when I hear what they say, the first thing that I think of is we as community leaders and community members need to hold ourselves accountable to be in contact with our elected officials and to be advocating for MONA moving forward. Representative Stevens, Representative Razor can't do this on their own. They need strong voices throughout the community. Representative Stevens, I'm really glad you called out the corporate sector in particular, who needs to step up and make really clear statements about the importance of this. Advocating for equality is, I think, where a lot of organizations, for-profit or nonprofit, need to start. Educating is really important. As I travel the country, I'm often stopped literally on street corners by volunteers from Human Rights Campaign to talk about equality, and it's really that person-to-person education that's happening. Investments in the LGBT community are so important. Certainly Vivent is going to continue to make those investments. We would encourage others to make those investments. That financial support into that community is critically important. We're all leaders on this call today, and we need to use our bully pulpit to advance the public dialogue and discussion as thought leaders around LGBT issues. And then we need to have discussions within our own company. I was really excited to be invited to address the LGBT staff of Wells Fargo here in St. Louis recently. Several hundred people joined in on that call, including some of their executive leadership. We need to keep this issue at the forefront. But I can't leave this segment, Jacob, without talking a little bit about another aspect of advocacy, and that is HIV criminalization. Now, there are laws in the books here in Missouri that make it a crime to have HIV. It is a statutory stigma, and we need to look at also cleaning up those laws that, as Representative Stevens said, come from another time and they need to be updated right now. We need to we need to pull those out of statutes so people with HIV, along with LGBT people, can feel like they're fully included and embraced in the community.
Mike, thank you. So I think as we've heard in this conversation so far, and this is back to our elected officials, there's still a lot of work that needs to be done around stigma, a lot of work that needs to be done around discrimination, which we know disproportionately affects members of the LGBTQIA community. We know that gay youth in particular are 3 times more likely to contemplate taking their own life, and 5 times more likely than the average person to actually try and go through with it. So I'm curious if we can keep this somewhat concise. Representatives, what we've talked about Mona, but legislatively, what action do you think we could see at the state level that sort of gets at this critical issue of addressing mental health for our LGBT youth?
Greg, you want to start?
Yeah, that's a big question. Look, I grew up in rural Southeast Missouri in an evangelical church as a closeted gay kid. I know mental health issues of LGBT youth because I lived them. Some of the smaller things that we can do, and I think about this when I'm speaking on the House floor, is simply being an openly gay man from rural Missouri who made it to the House floor. And if there are any kids out there listening, to make sure that they know that things get better. To have allies like Representative Stevens standing up from rural Missouri, letting those kids know. But LGBTQ youth face so many hardships, and we need to be investing in mental health services across the board, including LGBTQ youth. So many of our societal problems are really mental health problems that have gone untreated. We are learning now how to treat those, and part of that is going to have to be the state government making the conscious choice and decision to properly invest in mental health funding and taking care of the people in our society who could live happy, productive lives if only they had the medical care that they need. And so one of the bills that I've introduced is actually a mental health parity bill. In 2008, President Bush signed into law a bill that required health insurance companies to treat mental health the same they would any other health. Yet the enforcement of that was left up to the states. 48 states are enforcing that law. Missouri and Oklahoma are the only 2 that are not. So I've introduced that bill to try to get the state of Missouri to enforce that federal law and let people have access as best we can to mental health treatment.
Representative Stevens.
I am the chairman of the House Health and Mental Health Policy Committee. And as such, I have kind of stared into this abyss and wondered where we go and what we do. I've been talking for a couple of years, and I'm moving on this right now. I don't pretend to, in a discussion like this, throw out what we do to address this. I'm in the process of course, we have to wait till after the election and see who's going to be there and who's not, and that sort of thing. But there's a gentleman that I have spoken with about this, whose family has been deeply, deeply affected by mental health issues, who I am going to appoint. The speaker does the appointing, but if you want, but we're going to form a mental health subcommittee chaired by a gentleman that we'll name later, whose family has been deeply affected by mental health issues. And our idea is just to start with the mental health with the mental health department directors and the social workers, and begin to ask, what do you need? What can we do? One of my missions, if indeed I have one, is to knock down regulatory barriers that are standing in the way of mental health, or rather health healthcare professionals not being able to provide the breadth of services that they are educated to do. I mean, and this goes across the board. I mean, you can name any healthcare professional and see the regulatory obstacles in front of them that keep patients from having access to their knowledge and their service. And I am determined to knock down as many of those barriers as I can. And the area of mental health is one of those. I mean, I would love to see to have a regulatory environment where people who are already trained and can become trained to treat and to diagnose and treat mental health issues, to be able to prescribe the medicines for them when they can't. And I know this is being done in some areas and some states, and that's just one idea that I have about broadening the access, breaking down the regulatory barriers that stand in the way of access to people who are already trained and capable of providing many of these mental health services, but cannot because of the regulatory hurdles. That's just part of the things that are going on in my head that we're going to be moving forward. Obviously, I mean, it's becoming more and more and more apparent to more and more people that the extraordinary need for mental health services are just is a loud cry everywhere, and I hope to be a part of the solution, or at least working in that direction in the things that I described.
Well, thank you so much.
Jacob, let me jump in here if I can, Jacob, on mental health for a second.
Sorry, yeah, go ahead.
You know, first of all, I'm so excited that Vivent Health will be endorsing the mental health parity legislation that Representative Razor is going to introduce next term, and we're going to work hard on that, because there is no difference between physical health and mental health. You can't be healthy unless you're healthy in both ways. So thank you, Representative Razor, for what you've done, and we got to get Missouri across that finish line so that it's with the majority of states. And on the mental health front, I think there's so much that we can learn from the fight against HIV. I'm actually coming to you today from the mental health clinic in our facility in downtown St. Louis. It's a program that we're going to start right after the first of the year. We're grateful that we've been licensed by the state of Missouri. We know that between 50 and 60% of people with HIV have a mental health issue sometime during their diagnosis. And we've developed really outstanding nationally renowned approaches to addressing the mental health needs of people with HIV, including putting it right in the medical clinic. Right, we're here talking about stigma that the HIV and the LGBT community face. We have to acknowledge that sending somebody across town to a mental health therapist, there's all sorts of stigma associated with that too. We're bringing the mental health professional right into the medical exam room. We're screening every patient for depression at every visit. Those are the sorts of standards that we look forward to sharing and talking about here in Missouri to advance mental health, where I agree with Representative Stevens. I think there's a lot of common ground on this issue. I think a lot can get done on this critically important issue.
Mike, thank you. Really exciting to hear that our nonprofit medical sectors and our representatives, our elected officials, already working on legislation that hasn't even been quite introduced yet. So that's an encouraging sign. On an important issue, we do want to give our panelists a chance to get a glass of water, maybe stretch their legs. We're going to show you a quick video here as we move the conversation forward to hear from a leading national voice in the fight for HIV justice and LGBTQIA, equality. You may know her as Angina, stage name of Ryan on Palau. She sat down with the conversation for Vivent Health, and you know her because she rose to prominence as an American drag performer and HIV activist who came to international acclaim on the first season of RuPaul's Drag Race and the fifth season of RuPaul's Drag Race All-Stars, one of the very first reality TV stars to come out as HIV positive. Let's hear from Angina.
My name is Angina, but a lot of you probably know who I am from RuPaul's Drag Race Season 1 and more recently RuPaul's Drag Race All-Stars 5. But that was actually something that was scary at the time. I came out as being HIV positive on national television in 2009. And at the time, I hadn't even told my parents about my status being HIV positive. So there was a lot of fear, like this internalized fear that it wasn't going to be received well and that people will look at me as another statistic. And finally saw my coming out story. I felt like weight was lifted off of my shoulders because now I can really fully live my life free. And I can help with the stigma that is associated with the virus because I am an example of somebody who is living their life to the fullest, even though I am HIV positive. And that's really the message that I wanted to convey with that coming out. I mean, I was diagnosed a few years before that, and I remember not knowing anybody and not being able to talk to anybody about my status because I didn't know people. And so I felt like I was alone. Even though you have your friends, you just feel like you need to talk to somebody that's experiencing the same thing. And that was really hard. So I'm happy to be that person for some other people. A lot of the times the stigma associated with the virus really affects a lot of people. And that's one thing that I will continue to focus on as being out and open because I believe that a lot of people suffer from that. There has been challenges to our well-being as LGBTQ plus people, and we as a community, if not resilient, we fight for what we know is right. And I think that that's the fight that we need to continue to have because it is so important that we continue to have the same rights because we are human beings. And the fact that people look at us being different because we are part of the LGBTQ plus community is crazy to me. I really encourage everybody to go out there and vote and really like show up. And that is really the best way to be an ally, is to be present. And a lot of those people that I've met throughout my lifetime and friends of friends have always been present. And I just want to say thank you because a lot of people watching this are probably allies, and what you don't know how much it means to us LGBTQ plus people that you are always there and present and fighting the fight with us because we need you.
Angina, thank you so much for those powerful words. And now as we continue, I want to bring in another important voice to the conversation. Stephen Eisel is the Executive Director of Promo. That is the state of Missouri's largest LGBTQIA advocacy nonprofit, bringing both professional and lived experience to his current role. Stephen, you've had an opportunity to hear the conversation so far. And some research by Promo shows that LGBT Missourians have greater access to healthcare services today than they did maybe 10 years ago. But that same research also found that those individuals don't even know that they have access to those services. So I'm curious from your perspective, what can elected officials, Vivent Health, allies, activists all do together to bridge that information gap?
Sure. So thank you first off for having us, and certainly thank you to Representative Stevens and Razor for being champions for our community in Jefferson City. And I just want to say that we have to have open and honest conversations. And I think that one of the things that we found in our research and research more broadly is just the number of barriers that LGBTQ folks face. And part of that is that stigma, and another part of that is, poor experiences with healthcare systems. Part of what we do at Promo is doing trainings with healthcare providers, with clinics, with other folks within the healthcare system to what it means to engage with members of the trans community, to know the unique experiences of those of us in the LGBTQ community, and what are some of those disparate health impacts that we do face? So obviously, we're talking about making HIV history and understanding that, we are a community that has been ravaged by this disease over decades. This is deeply personal to me. I lost family members during the height of the HIV/AIDS crisis. So I think it's important for us to be able to share those stories and understand that those of us that are active in the LGBTQ community now really stand on the shoulders of those that came out and shared their experiences and their stories before us, and allowed us to lead the lives that we have now. But, we still have a lot of progress to make. We celebrate the progress that we have made, but certainly being able to meet people where they are and understanding that events like this one, where we are engaging with folks and sharing information and providing resources, is critically important. And understanding that in COVID-19 times where Pride events over the summer were canceled, those are the types of places where we often find members of our community and not only celebrate, but share those resources. So what are ways in which we can move those conversations online and connecting with particularly younger folks where they are, and how we can make sure that they have the resources and information they need to make informed decisions.
So we've sort of touched on this a little bit already. This could be open to any of our panelists, Stephen, Mike. If Missouri could move toward a more equitable environment for members of the LGBTQIA community, we know this, it would reduce economic instability, it would reduce health inequalities, and those would only benefit the state of Missouri overall. So what are the measures that you see that the business community out there could take to help advance this cause?
No, that's a great question, Jacob. And I think it goes back to some of the things we were talking about earlier. Advocate and educate, invest and opine. The work that Stephen's group Promo does is so important, and everybody should be signing up for his trainings. And if you are a manager in a corporation, you should bring the Promo trainings into your staff and into your company. That's so important. On the opine front, if you are a Catholic, today is the day to stand up and cheer Francis for coming forward and embracing and endorsing same-sex civil unions. And in that category of opine, if you are a Catholic, you need to sit down with your priest and tell the priest that they need to start preaching this from the pulpit. It is time for the churches of our society and our country to stand up and embrace the LGBT community. Doing things like Wells Fargo did, where they invited me in to speak to several hundred of their employees, is another great thing. I think Representative Stevens' point about this is beyond just an issue of human rights. It's beyond an issue of dignity. Those are very important. That's got to always be the core of our advocacy and our work on this issue. But it's an economic issue too. And the corporations in Missouri are losing out because Mona is not yet law.
So on that point, Mike, let me ask Stephen and bring him back. Promo has worked and built coalitions with the businesses that we have, whether they are in the city of St. Louis or across Missouri. And nationally, many businesses advocate for LGBT rights, right? We know that 9 out of 10 of the top 10 Fortune 500 companies, that was a lot of numbers, so 9 out of the 10 of the top 10 on the Fortune 500 companies have direct policies that protect their employees based on or from gender identity, sexual orientation discrimination. Stephen, from Promo's perspective, what role do you think the business community plays in advancing Mona and LGBTQIA rights across Missouri?
I think it has a huge role to play, and this is businesses large and small. So it's whether it's a Fortune 500 company that's headquartered here in Missouri, or whether it's a small mom and pop shop, in any corner of our state, it's important for them to live out the values of their customers, their employees, their family members. I would encourage folks, there is a business coalition called Mo Competes, that those of you that are watching today, or whether you watch it later, if you are a business owner, if you work for a business, we encourage you to check out the website, which is MissouriCompetes.org. So you can find information there about that economic case. And one thing that we know, especially on equality issues, tourism, conventions, sporting events, these are massive investments in states like Missouri. And we've seen states that have gone too far in attacking the LGBTQ community have seen millions of dollars leave their states because the NCAA has, pulled out of states before over various issues. And, we have seen conventions pick different cities. And one other thing that I would say is millennials are, I think, on track by 2030 to be 70 to 75% of the workforce. I'm a millennial myself, and studies have shown that 80% of millennial employees want to see these types of non-discrimination protections in their businesses, in their communities, and in their state. So we know that public will is on our side, and I think it's important for us, to share personal stories and also to, use the economic leverage that we have to make sure that our legislators are also understanding the importance of this issue.
An argument which seems to fit nicely with what Representative Stevens was saying earlier about maybe that is the most compelling argument moving forward for advancing MONA in Jefferson City. One last question that we do have for everyone today on our panel, and we're going to start with our elected leaders here. Each of you who are part of this conversation are an individual, and you're part of a coalition, right, in this collective fight we all share to secure LGBT rights, fight stigma, make HIV history here in the state of Missouri. But I'm curious, what are the key elements that each of you see that are missing currently from broadening this coalition, bringing more people under the same tent to finally claim victory here? If we could start with our representatives and maybe go around the room.
Greg?
That's a big question, and I wish I could ponder it more, but what immediately jumps out to my mind is that we need to be willing to meet people where they are in the conversation.
Yes. Thank you.
Yes. We have to meet people where they are. I will tell you, and this, I'm not referring to Representative Stevens here, I have met with several members of the Republican caucus privately who have sat down and wanted to ask questions about the LGBTQ community. I had one who started with, Greg, I've never known an openly gay person who I felt comfortable asking questions to. And we sat for 2 hours and had a conversation. I had another rural Republican representative who said, Greg, 10 years ago, I would have been against you on lesbian, gay, bisexual issues. Now I'm with you. But I'm not with you on transgender issues. But I have a feeling 10 years from now I will be. Tell me what I'm missing. And we got to have that conversation. And then I'll be introducing a bill next year, hopefully in the Senate, that Representative Krista Finelli has introduced in the House. That's a HIV bill that deals with PEP and PrEP. We had to wrap our heads around some of the folks on the committee perhaps really haven't followed HIV news since maybe Magic Johnson came out as positive. That might have been the last time they really thought about it. So there was a lot of catch up to do on the science and the technology and what does undetectable mean and viral loads and CD4. And as we had that conversation with the committee, I could literally see light bulbs going off on the heads of all these members on the committee. And that bill passed unanimously out of the first committee. Then COVID hit, and so it didn't make it any farther. But I think when we go out, don't get mad at people because they're not where you are at the first moment. Allow them to come along.
Thank you.
Okay,
And Representative Stevens here is a great example of how allowing that to happen gets you an ally.
Representative Stevens.
Well, I'll just kind of reharp on, I won't reharp on what I said earlier. But Greg, you know, when we're so involved in our own issues, and this, what I'm going to say, applies to everybody who wants something out of the legislature. Our passion for it sometimes gets in the way of the political nuts and bolts. To begin with, you have to understand, to begin with, obviously, you're going to come with a full plate. You're not going to give away your passion prima facie. I mean, you're just not going to say, well, I know we can't have everything, so forget that part of it. I get that. But at the same time, Greg had the perfect thing to say about this. You've got to come to these people where they are and have to understand where they are. And Greg and I both have said this. There is a lot of goodwill simmering. There really is. But this is a step for a lot of people who are uncomfortable with this issue, and you have to respect that in order to make this advance. And it doesn't mean like you agree with, if they just fully disagree with you, you think that's fine. I'm kind of wandering here, and I don't mean to be. I just looking for the way to kind of embellish what Greg said, and really what I said, and that's why. And what I said earlier was very much what Greg just got through saying. You have to come to these people. You have to come to these people where they are.
That's a great way of putting it.
These people where they are. I mean, that's leadership of any kind. You have to come to people where they are, and give them some comfort to have them move to where you are. And this idea that I keep harping about this being this has got to be an economic, it has to be approached as an economic issue, is precisely what I was talking about, what in light of what Greg said.
Okay, Mike. I'm sorry. Go ahead.
No, go ahead. I've gone on longer than I should.
Meet people where they are is a great way to put it. Mike and Stephen, just quickly on the issue of broadening our tent and to make the best argument. Any final thoughts on that?
A couple of things. One, this is an instance where size matters. So I think we've got all the right players at the table. We just need to make the tent bigger. And then I just want to leave on two U.S. Supreme Court references. One, I think it was the late Justice Ginsburg who said, fight passionately for what you believe in, but do it in a way that others can join you. I think that's a great compliment to what we've heard from the representatives today. And a more alarming note, right? Justice Thomas, Justice Scalia are starting to publicly ask questions about the U.S. Supreme Court case that legalized gay marriage, and that may be under attack moving forward, which makes it all the more important for us to be making progress at the state level on LGBT rights.
Stephen?
Sure. So I will just say two things. I think one is in Jefferson City, often we find things kind of breaking down between rural versus urban. But one thing we certainly know is that the LGBTQ community and members thereof are in every corner of the state, in big towns, small towns, college towns, all around the state. So that's one thing I would say. And then the other thing I would say is, thinking about who's not at the table and how can we make sure that we're bringing folks in. So I am a very strong believer in collaboration and partnerships. And as I said before, just being able to talk about how this can be an intersectional issue as well, and understanding that the trans community in particular faces more of the employment and public accommodations discrimination. And we see HIV hitting harder in communities of color. So making sure that we're being honest about what that means and making sure that those voices are also part of conversations.
All excellent points. And before we end today's conversation, we do have another video from a very special guest. I do want to bring in Krista Lou Cunningham into the conversation. She taped a video for us. Krista is currently serving as the president of Pride St. Louis. And what's so really remarkable about that is that she is the first trans person to hold this executive role for that entire organization, which is really something to be celebrated. And in addition to her work with Pride, Krista has been serving our St. Louis community as a home ownership counselor for local nonprofit housing organizations and also for local financial institutions and helping people obtain their goals of home ownership. So before we conclude today, let's hear from Krista.
Good afternoon. Thank you for joining us. I'm Krista Cunningham, the president of Pride St. Louis, the first trans person to serve as president for Pride. Stigma, I know it all too well. I live it 24/7, 7 days a week. Stigma inside of our community and also outside of our community. Stigma is the last hurdle to the finish line for equality. We must work together to overcome the stigma and to finally pass Mona. We know we can do great things. We've done great things together. We need to do it again. A trans person was tired of the stigma, threw that brick at the Stonewall riots. Trans people were there to fight the stigma for those with HIV and AIDS when their families rejected them, to be clothed, fed, housed, and buried. Trans people were also there to help you fight for marriage equality. Love is love. Mona, it impacts all of us. Together as a community, along with our allies, we can come together and finally get Mona passed. Thank you.
And thank you, Krista, and thank you to all of our panelists today. Representative Stevens, thank you for your time today. Look forward to your work in Jefferson City next session. Representative Razor, soon to be Senator Razor, looking forward to your work in the upper chamber next year. Also want to thank Mike from Vivent Health and Stephen from Promo, Missouri, both of you lending very important voices to this conversation. I think as we sit here today, it represents another crucial point as we all work together toward fulfilling a mission, and that is a world against or without HIV and AIDS, and ensuring that everyone, absolutely everyone, can live long, healthy lives. I know that Vivent Health and their partners here today invite everyone who's watching at home to join them, follow them on social media. You can visit their website to learn more. And they want to leave you with the message of using your voice to lift up people, combat stigma, wherever you see it, call it out, and help ensure that access to a full participation in society is available to everyone. No discrimination, regardless of where they live, who they love, their race, their gender, or their sexual orientation. It's been my honor to moderate this conversation. I want to thank Vivent Health for being part of this, having it, inviting me. And everyone watching at home, thank you so much. Stay safe, and everyone take care of themselves. That does it for today.